Okay, so we move on with the Q Breakfast Show now. This time around, I'm joined by Dr. Geetha Shivraj, who's coming in from Dr. Agarwal's Eye Hospital, which is in Lusaka here, and she's a consultant there. So she's going to be just helping us understand a lot about eyes and how you can keep your eyes healthy with your lives. Eyes are a very important part of your lives. Thank you so much for coming through, Doctor.
Good morning, Mr. Jonah. I'm so happy to be with you.
Well, we would like to talk about eyes today,
Sure.
but to get started, there's something very important that people need to keep in mind, and that is something that affects a lot of people: blindness. So we would like you to tell us more about blindness and what cataract is.
Yes, we have to know about what is blindness. And there are two types of blindness. One is preventable blindness. Another one is, irreversible blindness. Okay. And cataract, you wanted to know about that. And it is an aging process where the lens will become opaque. It will not transmit the light. So what happens is the light rays are reflected. Then the patient won't be able to see. Many people, they don't know that it is an reversible blindness. Okay, the cataract can be removed and we put a new lens. So the people will be able to see, and they have to wear glasses for the near vision. Sometimes if they don't want to wear near vision glasses, we have a lens, special lens to help them for reading also.
Okay, so could there be possible advanced treatments for cataracts, and what could those be?
Yes, when you have a cataract, there are different types of techniques. Initially, they were opening the cornea, in a larger section, and later on it became a small section. Whereas now we are doing with the 2.8 millimeters opening. In that we do a phacoemulsification technique. What does it do? It will break the cataract into small particles, and it will aspirate. Once the cataract is removed from its bag, then inside the bag, the lens, the foldable lens will be injected. There are two types of intraocular lens. That means, what is that intraocular lens? The lens we put it after removal of the cataract. So there are two types. One is monofocal, another one is multifocals. Monofocals will give you the distant vision, and for near you have to wear glasses. Suppose if you do not want to wear glasses, then you can use multifocal intraocular lens.
Okay.
Yes.
Okay, thank you so much for giving us that information. However, there's something that I found interest in that is also very interesting, and that's glaucoma. Tell us more about it.
Glaucoma is a very dangerous disease. Many people are not aware of it. Why? Because it is a silent killer of vision. You understand? We have body pressure, correct? So we call it as blood pressure or hypertension. Similarly, eyes also will have pressure. Suppose if it is within the normal limit, it's fine. If it is not within the normal limit, if there is a block in the outflow of the fluid which is secreted inside, then slow building up of pressure will be unnoticed. It will not create pain if it is an open angle glaucoma, but it will enlarge the optic nerve which helps you to see, because the retina is a layer where the images are focused and made a clear image of what we see, and it is transmitted through the optic nerve. This optic nerve head, because of the pressure, this will be damaging the optic nerve fibers. They are thinner than the hair fibers, like that. So peripherally, you will be losing the optic nerve fibers, and this will cause a side vision loss. So when a person is driving, he cannot see the vehicles which are coming in the side view. So these are all the problems. But unfortunately, since they don't have any warning signals, and they come in the advanced stage, and whatever the optic nerve damage had happened, it is irreversible. Okay. So rest of the percentage of vision only we can maintain.
So what is the best way to deal with it? Is it to seek medical attention from time to time, to visit the doctor?
Yes, exactly. Around the age of 45, generally this intraocular pressure rise will start. So people do not come to the doctors. They go to the opticians and take the glasses. So they are not aware of their optic nerve changes, whether the corneal problems are there, whether they have a normotension glaucoma, or glaucoma due to different problems, and the optic nerve assessment all will be done by eye doctors only.
Okay.
So we have got certain baseline tests. So we will do the investigations if they are suspicious or it is confirmed. From then we can give the medical treatment. So when you give the medical treatment, they will preserve what is there in them.
Okay.
What is lost, we cannot do anything.
Now, a lot of people are suffering from high blood pressure and hypertension as well as diabetes. So, what impact does that have on their vision?
Yes, it has impact. Diabetes is a systemic disorder. It affects the smallest blood vessels in the brain, kidneys, eyes and the heart. Usually coming to the eyes, it will start with, supposing if a patient is having diabetes since 5 years, not had come to an eye checkup, it will start to give a small dot-like hemorrhages, followed by fluids and followed by more flame-like hemorrhages, all those things. So then one fine day they will come with the vitreous hemorrhage, meaning bleeding into the eyes. Then treatment will be surgical. Supposing if they come for the regular checkup, we can treat the early diabetic retinopathy with retinal lasers. And we have intraocular injections also, intravitreal injections we can give. So the progress is inevitable, but we can slow down the progress.
Oh, okay. So it's inevitable anyways.
Yes.
Okay, so is there treatment for albinos? Because we know that there's a bit of a problem there. And what treatment could be available for them?
Yes. For hypertension?
Yes. Yes.
For hypertension, supposing what happens if the disc, the optic nerve head is swollen, we can give medical treatment. And if there is any hemorrhages, then we can give the surgical treatment.
Okay. A lot of people do suffer from a squint. And I think we can all relate to that. So is there a treatment for that? How can you fix it?
Yes. Usually when the child is noticed to have a squint, they have to come to the ophthalmologist, because two things need to be corrected. Sometimes the patients need to wear glasses along with a surgical correction. Both are possible.
Okay. How this should be like a very big case though. Eye transplantation. How do you do that, and what is it, and are you able to do it?
Yes, we are doing in Dr. Agarwal's eye hospital. You know very well, we are doing it in 10 countries in Africa. And this corneal transplantation, why do we do it? This, when the cornea becomes opaque, cornea is a structure which is transparent and in front of the eyes. Okay, the black portion is there, no, in front of that, and it transmits light. Okay, if every portion is okay, when the cornea has got some opacity, it will reflect the light. It will not allow the light to go in. So after the damage of the cornea, where the light doesn't pass, the patient becomes blind. Correct? So we take the donor cornea from the human eye after the storage, and we just order from the international eye bank. We get the donor's eye, and then we remove the opaque portion of the cornea, and we take the button, corneal button, and then we suture it. So this transplantation is a major work, and we have to create awareness for it. Okay. Because eye donation is many people not aware of it. You know, it is after death only people will donate, and in India, in Sri Lanka, and many parts, many people are aware of it, and we have to bring it to the notice. These eyes are donated after death.
Oh, okay.
Yes.
Very interesting.
So we have eye banking. We will store the eyes, and the eye button, corneal button alone can be transplanted.
Okay. So now this should be a question that I'm sure everybody would be eager to hear. Does HIV have an impact on somebody's vision?
Yes. HIV will affect, similar to diabetes and hypertension, the retina will be very badly affected. One of the thing. There may be sometimes bleeding, okay, and sometimes optic nerve will be affected. Sometimes conjunctiva, if you take, there may be a small growth, and advanced Kaposi sarcoma also will affect the lids and the conjunctiva, and sometimes they will have uveitis. So these are all very important things to be considered, because early stage treatment will reduce their progress. And supposing if they are taking the treatment, I think the progress will be very slow.
Okay.
Otherwise, it will damage vision.
Now, I think this is a tip that I personally want to use. How can somebody maintain good eye health?
Yes, this is very important, quite interesting too. And what is nutrition? Nutrition is actually everybody should have a knowledge about what we eat. The 5 things are: one is carbohydrates, proteins, fats, minerals, and vitamins. Many people have to understand that they have to balance it when we are eating. Even I don't like to balance diet.
It's a little bit more fun when you have an unbalanced diet.
Exactly. But though I don't like, I'm doing it. Why? Because I have to be healthy. A sick person cannot treat the another sick person. Correct? We have to be healthy. So when you are eating, you see that limited carbohydrates, needed proteins, limited oil, and minerals and vitamins. So we'll just see what all in that. So many people do not know that vegetables and fruits contain lot of vitamins and minerals. Okay, vitamin A, vitamin B, vitamin C, everything is required for the metabolism of all the other things, and forming new cells in the body, removing bad cells in the body, and maintaining good health. For the eye, all orange color vegetables like carrots, this papaya and pumpkin, all orange color, they contain carotene. Then it will be converted into vitamin A. People who are eating meat and egg white, egg and fish and chicken, bit of meat and butter, all those things also have vitamin A directly.
Okay.
So this is very important for the retinal pigments and retina, because vitamin A is the one is taking the images and converting the photochemical reactions into the nerve impulse. So it is very much required. And other vitamin B, vitamin C, everything is required. And I can very well say you can avoid deep fried oil items, and you can eat occasionally. It is not that. So you have to have balanced diet. And even I have read in a few places that Luapula, that river, like eating fish. Many people used to ask me. Actually speaking, I heard they are eating cassava and the fish. They are removing the liver portion of the fish. So they are eating only proteins and carbohydrates.
Okay.
They are not eating all the nutritious
So that's where the problem comes in.
Yes, it is a multi-nutrient deficiency.
Okay.
It is not only because you are eating fish you are getting problem, not like that. And you are not eating the rest of the thing also.
Okay.
You are taking only protein, you are taking only cassava. And it doesn't solve any purpose. You have to take everything.
Okay.
So nutrition is there in everything. Then you have to know what to use and how to eat food. What is the calories. See, for some people, they are using a sedentary lifestyle. Some people moderately. Some people have the severe physical work. So according to the necessity, you have to take the calories.
Okay.
So it should be balanced.
It should be balanced. I'm sure one of my colleagues, Luendo, would be very excited because she's always talking about diet and health, and she's always in the kitchen. Anyways, moving on. The TB drug has been subject to a lot of talk, and people saying that it has an impact on your vision. Is that true?
Yes, because some medicines are toxic, and you have to come to the doctor for the optic nerve assessment. Otherwise, they will lose the vision. Yes.
Okay, so
yes,
it does
optic
have an impact.
Yes.
Okay, now.
So that when we see, we will do the autoperimetry test and see whether they are having any problems in that. And then we will inform the physicians, and they will reduce the dose, or they will give an alternate drugs.
Okay. What is the dry eye syndrome?
This is most commonest. 40% of the Zambians, they come to the our institution because of dry eyes. Because these days you see everyone uses computers. Like constantly looking into the computer. And so the blinking is, the frequency of blinking is reduced. So there is dryness in the eyes. These are all occupational. And basically because of the humid weather, pollution, dust, and the dry weather, all those things also will affect the eyes. Supposing if you have dry eyes, these are all the aggravating factors. In that you will have redness, you will have pain, you will have watering, all those things. So you have to come to the doctor. We will check how much is your waiting time, how much you are blinking, whether any dry spots are there, all those things. Accordingly, we give you the lubricant eye drops. For a period, you have to do it, and you can avoid, consciously, blinking, so you can avoid the dry eye syndrome.
Okay, so it's not always that when somebody has the dry eye syndrome, they need to get glasses or something.
Supposing already if you are in the computer, it is a protected screen, you
Okay.
can wear plano glasses, coolers you can wear, no problem. You can use transition glasses. And in elders, the problem is with the lids. The people, older group, they have a lid related problem. So the lids will have a small pores which will secrete the oil. The tear secretion has got three components. Water, mucin, and the oil. So what happens? The oil block will be there. The blepharitis, the lids problems. So because of the oil deficiency in the tear secretion, they will go for again dry eye syndrome and other problems.
Oh, okay. So now I would like us to talk about the refractive surgeries and the ICL. Just give us more information about that.
Yeah, it's quite interesting. And what is refraction? Okay. See, when you just look at me, okay, look at me, close your eyes. Do you see me now?
No.
Open your eyes. Can you see me?
Yes.
Where do you see me?
Here.
Close your eyes. Still I am sitting here. Do you see me?
No.
No. Then where do you see me again?
Here.
No. You are seeing me in the retina.
Okay.
In your retina.
Okay.
Because my image is falling on your retina. So what happens is, in the retina, when the focus is there, clear focus is there, you will have a clear view. Correct? Sometimes certain distances will be seen clearly, certain distances will not be seen clearly because the lens is not focusing, and few other factors. Got it?
Okay.
So in the retina only you are capturing my image, and it is being processed and taken to the brain. Correct? Suppose certain distance falls in the retina, certain distance do not fall in the retina. Then you need to wear glasses to have a full distance coverage.
Okay.
So this is called the refraction part of the eye. So when the light is traveling inside, it is called refraction. When it's coming to the focus and giving you a clear image, you don't need glasses. If not, you have to wear glasses.
Okay. But finally, why is it important for people to wear glasses?
Yeah, because what happens if you do not, this is very important, all the parents will ask me why my child should wear glasses. Only then all the focus, all the distances, suppose you have to see, we have got a, this one, we have got certain parameters that this distance you have to see, this letters you have to see, that parameters are there. So you need to see all those things. Supposing if you do not see, then we will assess you. So how much you are not seeing. If you do not correct the refractive error by glasses, then you will have an amblyopia, meaning lazy eye, or you will suppress your vision. Sometimes you will squint. And suppose at the age of 20, your occupation demands 6/6 vision with glasses, then you won't be able to apply for your profession, lovely profession. So it is very much required, you have to correct. There are three strategies. One is the spectacles. Initially we give spectacles for children, and from the age of 13-14 we are giving contact lens, and around the age of 18, when the power is stable, we can give the refractive procedures. For a high power, we have got that is intracolumnar lens. We have lens which is not focusing sufficiently enough. So in front of it we can put one more lens.
Okay.
That is called intracolumnar lens. We can put that. We are doing it in our center. We can do it.
Okay. Thank you so much for coming through, Doctor.
Thank you very much. It's
Absolutely.
my pleasure too.
Well, we've learnt a lot.
Yeah, thank you very much. The main important thing is creating awareness. And we, Dr. Agarwal's Eye Hospitals, we are the largest chain in eye care center, and around 65 centers we have across the world. and around 10 countries we have in Africa, and we are just expanding, and we are happy to be here to,
We're happy to have you.
yes, to create awareness and prevent blindness.
Absolutely. So you can actually keep yourself safe with your eyes, because we're going to give you an opportunity to go to Dr. Agarwal's eye hospital, and get your eyes checked at 50% discount. So if you'd like that, you can actually get in touch with us by calling us, and then we'll give you the opportunity to go there before Friday. We're going to give you